Generally speaking, I do see a lot of patients with pelvic health concerns like pelvic pain or pelvic floor dysfunction, vulvodynia, vestibulodynia, other sexual health concerns like difficulty with orgasm or low libido. As we have more patients also on, the GLP-1 receptor agonist medication, we're seeing more patients come in with that potentially affecting those things. So some things we've seen are maybe some decreased libido, um, and just changes in like vulvar appearance due to weight loss. Um, I think I have a few colleagues in this space too who have had more patients who have come into their clinics, and we kind of talk about kind of the stories that people bring in. And then also there's been, some publications online from other clinicians. And so that I think that's primarily where our interest was ignited with this topic, because through like my conversations with other clinicians, and there was like a big article on Healthline, I think, about Ozempic vulva. Um, so that's kind of where we got this idea to take a look at TriNetX, using the big database to see if we could find anything significant. We used TriNetX, and did propensity matching to look at patients who were on the GLP-1 medication, and looking at specific diagnoses of either hypertrophy or atrophy of the vulva. And so there's not like like Ozempic vulva isn't obviously a medical diagnosis, right? So we were trying to figure out how we could capture that. And primarily, like when people come in for, um, like they have excess labial tissue and they are interested in like a labiaplasty, oftentimes they're diagnosed with hypertrophy of the vulva or labia, to try to get insurance coverage. Sometimes patients are also diagnosed with like pain of the labia, things like that, to try to get, again, insurance coverage. So we looked at hypertrophy of labia or hypertrophy of the vulva. And then on the flip side, we also wanted to look at atrophy of vulva, that is more of a like diagnosis associated with like GSM or genital urinary syndrome of menopause, just like the atrophy of the vulva. But we kind of wanted to look at that also to see if there was any significant findings in that area. So basically, with the propensity score matching, looking at patients who were on the medication and patients who are not on the medication, matching for demographics and all other medical conditions, there was basically no significant increase in those diagnoses, hypertrophy or atrophy of the vulva, with or without the medication. So I think that is an interesting finding, just that there's not a significant amount of like either atrophy or hypertrophy, um, despite, a lot, like some reports of it, like clinical reports of it or anecdotal, evidence of it, that it's not like a significantly increased risk of it. Of course, there's a lot of issues related to using TriNetX and other big database data for these kinds of studies. There's limitations with using that. Uh, there's the like, are the patients being screened for these diagnoses, right? Like, is the provider who's prescribing these medications, are they screening or diagnosing patients with those diagnoses? Or, it's really only when those patients have significant concerns that they're um, coming forth and being evaluated for that. And are they being screened by those providers, or are they being separately diagnosed by other providers? right? And then, of course, there's barriers to that, like reaching a provider who can screen for sexual health or vulvar concerns. So that there's definitely room where we could be missing patients with those diagnoses. I think that this data is helpful to just kind of address the general concerns that um, there's not really a significant change in vulvar appearance across the board. Like it's not really something that everybody has to worry about. But that being said, there are some limitations to a big database study like this. So, each person, the way that their fatty tissues are and their skin tissue is, they might notice some changes in their vulvar appearance. And so that kind of leads to the conversation about, what are our like what is normal or what is not normal, or what do people like kind of socially or culturally consider like a beauty standard, and then what do we need to intervene on um based on kind of the patient's level of like distress over their appearance versus kind of the functional aspect of the vulvar tissue. Like, is there excess labia causing discomfort with different like clothing or things like that. Um, but yeah, that's kind of a bigger conversation about kind of just labial tissue and labial hypertrophy. But yeah, I think those are all valid concerns that patients might want to bring to their gynecologist or urologist. So skin changes can occur, throughout the body. And so vulvar skin is, just kind of could be a place where you have skin changes, just like you have it at anywhere else in your body. I think that it's important to address those if patients are having significant discomfort or concerns related to them. And that really kind of relies on the provider to initiate those conversations, because oftentimes patients don't think that their providers want to hear about their vulvar or sexual health concerns. Um, so I think as a provider, a urologist or gynecologist or any other provider in this space, just being open to initiating the conversation, asking if there are any concerns about vulvar or pelvic health, any changes to the vulvar appearance or to even their pelvic floor function. So things like uh, bladder concerns or leakage, incontinence, or overactive bladder, or even sexual health issues, maybe like decreased libido or decreased intensity of orgasm related to pelvic health muscle or pelvic muscle health. Those can be things that patients would want to talk with their providers about.